Paramedic Special Populations, Chapter 45, Patients with Special Challenges, Part 3. In this lecture, we're going to briefly discuss care of bariatric patients and care of patients with communicable diseases. Bariatrics is a medical specialty dedicated to the prevention and treatment of obesity. More than one-third of American adults are considered obese, and to be considered obese, a BMI of greater than 30 kilograms per meter squares, and morbidly obese is going to be between 40 and 49.9 kilograms per meter squared. Extremely obese, body mass index above 50 kilograms per meter squared. A wide variety of lifestyle, genetic, metabolic, and environmental causes is responsible for obesity. Obesity causes or worsens, among others, heart disease, cerebrovascular accident, diabetes, hypertension, some cancers, and asthma. Also, obese patients are more prone to physical injury and also a variety of musculoskeletal problems. Routine procedures for obese patients are extremely complicated. Airway procedures are more difficult because of a larger tongue, larger patient head size, limited neck mobility, and difficulty to see the anatomy of the airway. Bag mask ventilation may be ineffective with patients in the supine position. The ramped positioning has a positive impact on chances of successful airway management. Use pillows and/or blankets or commercially manufactured ramping devices are available where we set the head up just slightly. This will help with airway management. Diminished respiratory reserve decreases the window to perform airway procedures before hypoxia. To avoid endotracheal intubation, the patient will often need bag mask ventilations with PEEP, or positive end expiratory pressure, CPAP, continuous positive airway pressure, or BiPAP, bi-level positive airway pressure. Peripheral IV access is often problematic in the obese or bariatric patient. Large neck mass may obscure landmarks for external jugular IV line placement or even surgical cricothyrotomy. Conventional IM needles may not be able to reach IM space through excessive adipose or fat tissue. Absorption and distribution may be altered for lipophilic medications or medications that are resistant to fat. Auscultation may be more difficult through extra-abdominal and chest wall mass. Operational concerns for the bariatric patient. Obese patients are often too heavy for two-person EMS crews to transport safely or effectively. Additional lifting assistance frequently is necessary. Small rooms and narrow staircases may limit using additional lifting personnel. If weight is extreme, you may exceed the carrying capacity of stretchers, backboards, or stair chairs. Careful planning and proper body mechanics are essential to avoiding injury. Paramedics need to advocate for EMS equipment capable of safely transporting obese patients. Larger blood pressure cuffs, longer injection or intraosseous needles, or special cervical collars may improve patient care. Providing the best care possible for this group includes careful planning, understanding the challenges involved, and proper equipment. Care of patients with communicable diseases. Communicable diseases are infectious diseases that can be passed from one person to another by a variety of modes. The severity ranges from completely undetectable to causing death within days or weeks. Safety precautions should always be followed. Gloves and eye protection should be mandatory. Use gowns, masks, and other protective measures as warranted. Significant psychosocial implications accompany some communicable diseases. They can take an emotional toll on the patient, family, and other loved ones. Certain diseases are associated with lifestyle choices not accepted by others. People suspected of having a communicable disease may face discrimination, stigmatization, threats, or hostile treatments. Respect and privacy by paramedics is essential. Assessment and communication should be conducted in private. Unnecessary release of private information to bystanders could adversely affect the patient. There even may be legal consequences for violation of privacy rules. Patients may acquire a disease through occupational exposure, sexual assault, blood transfusion, close family contact, and a variety of other methods. Assumptions based on stereotypes may undermine patient care efforts. In the next section, we're going to discuss medical technology in the pre-hospital setting. This concludes part 3 of chapter 45.